Hi, today we're going to talk about my learning goal journey of understanding how good care is operationalized in the healthcare services. So, a quick overview of what we're going to talk about. We're going to look at the US health system today, why it's important to operationalize good care, what value based care is and how that plays into the picture, various implementation, and then some final takeaways. So, a little bit about me and why I chose this learning goal. It really aligns with both my professional and my personal interests. I'm an HOD and MHS double major, and I want to pursue a career in the business side of healthcare. Not only is this relevant to the site that I'm working at now, my internship in the summer, I would really like healthcare to be a part of my post grad life. So, at my site for right now, I'm working at Upperline Health, which has a series of nationwide clinics delivering podiatry services and other comprehensive care, mainly to populations that have a lot of chronic conditions, like Medicare patients. And then some strategies that I employed to understand my learning goal is conducting some independent research, having conversations with our C-suite leaders, and then also collecting patient reviews. So, looking at the need to operationalize good care, I remember one of the first days at Upperline, the chief medical officer of Upperline Plus just was talking to me about what value based care is, and she said it's evident that our system is broken. And this will be found in lots of different facts. So, as you can see in the charts on the right, the US has the highest expenditure per GDP, yet experiences some of the worst outcomes among high income countries. So, in this graph, it shows that we have the highest, by far, avoidable deaths per 100,000 population, about 100 people higher. We also have the highest infant and maternal mortality. We have the lowest life expectancy at birth, and then the highest incidence of chronic conditions. So clearly, we are spending so much to see so little returns, and what's the gap? So that breaks down into why good care should be operationalized. Good care is great in theory, and a lot of hospitals and healthcare services start with the intention to make people feel better. But as we can see clearly, there is a gap, and that is not what's actually occurring. So it's also important to operationalize good care because there's a lack of incentive when nobody can tell if good care is actually occurring. So the healthcare system today is so complex and convoluted that even doctors and patients and everyone in between are just trying to survive, and no one really has that big picture image. And then finally, it's important to operationalize good care for accountability purposes. So how do we know if we are not providing good care? How do we know if we are improving towards our goal of providing good care? These are all important things that we should establish metrics for. So something that has been pretty synonymous with good care is value-based care. Now, this idea was launched by Michael Porter in 2006, but it has only recently been a topic of conversation in the past 5 years. So the whole secret to value-based care is aligning the incentives between delivering good care for patients and growing margins for hospitals by switching to a customer-focused model. So this is alternative to a fee-for-service model where providers are paid and reimbursed based on the amount of tests that they run, the amount of time that a patient comes in to see them. And obviously, these are all things that they would rack up if their patient needed to keep going back to the doctor and needed to keep getting tests and the problem wasn't solved. So these incentives in a fee-for-service system were really misaligned. And I think this quote from Michael Porter summarizes it really well. Value-based healthcare delivery motivates and rewards providers who deliver the best outcomes at the lowest costs and penalizes those who fail to effectively improve patient health. So what good care and value is health outcomes that matter to patients at the lowest costs. So here's another quote that just says, we must move away from a supply-driven healthcare system organized around what physicians do and toward a patient-centered system organized around what patients need. And this is, again, just focusing on that shift in perspective. So looking at these metrics for success and how we operationalize good care, this is really important to look at how these factors change and kind of reframing them from the patient perspective. So obviously the patient experience is going to be really important, and this is both in clinic about wait times, your ability to get an appointment after scheduling, cancellations, the paperwork that you do, does it correct the right information? As well as outside of the clinic in terms of ease of access, integrated care, and caring about the whole person, and just having a supportive team on your health journey. So condition-based outcomes, previously it was measured in things like the processes and compliances that really only mattered to doctors, but now condition-based outcomes is saying with the patient experience, what affects them? What is this treatment? What is their health outcome in terms of their health status? And then finally, empathy and interactions is something that was really highly resonated among patients and patient reviews. They say that they care about things like feeling genuinely concerned from their doctor, feeling understood, feeling like their doctor is trying to make a plan that works with their greater life and not just seeing them as a number. So then some tools that are used to measure this, I won't get into the nitty gritty, but a net promoter score really measures patient satisfaction about how likely you would be to recommend receiving care at this clinic. Service use rates looks at utilization of hospital admissions, emergency services, ambulatory services, because obviously that's something that is really expensive and that we want to decrease if it can be better care can be provided otherwise. Patient reviews are a really good qualitative direct source. And then the cost of care is this switch from a fee for service to a more bundled payments that's saying you have this condition, this is what it should cost to treat this condition, and any ways you can cut costs and provide better care is going to be your savings, and that's how you're going to get profitable and be successful. So then looking at some barriers to implementation, while this does seem like a really obvious switch that correctly aligns incentives, it's important to understand that this is a huge switch for the healthcare system. So first of all, starting with internal infrastructure, there's a lot of miscommunication between doctors and departments and a lack of consistent healthcare records that makes this really really easy care and transferable care among patients really difficult. And culture is also a big factor. So I was talking to the learning and development director, and she said that many physicians who have been in practice for years do not see why the change is necessary. And it's a whole different mindset to really go from fee-for-service to this value-based system that kind of flips it on their head. Payment models, with the number of payers, there's a growing number that are providing this new value-based care type of reimbursement, but there's still a limited number of plans, and this is something that the Center for Medicare Services is actually spearheading and kind of pioneering. And then finally, fragmented services. It's really hard. A patient with chronic condition might have 4 or 5 different specialty doctors where they're getting redundant tests, their medications aren't working, and there's no clear integrated healthcare experience for that person. They're very distinct and separate. So that's just a really big switch that I would need to have in order to make value-based care accessible. So here are some of my main takeaways. So I had a lot of things just about learning how value-based care operates, who are main players, what are the key drivers in integrating value-based care in the health industry. But I also had a lot of personal growth in terms of getting an understanding of how this really relevant trend is going to impact the health field and almost any healthcare business that I'm going to be entering into, as well as getting to hear from a lot of different stakeholders about their perspectives of value-based care and what it looks like and what it means. And then it's also important to recognize that there's so much more to learn, and this is just the start. So thank you.